Okay, let's now talk about some pathological terms in regards to lung disorders. And the first one I want to mention is something called atelectasis. A means obviously without, tel means complete, and ectasis means dilation or stretching out. And this is what happens sometimes in the lungs. Remember, we have all these small millions and millions and millions of these little alveoli, these little air sacs. If they're not being used, what they do is they sometimes just sort of collapse down on themselves. And a certain wedge-shaped area of the lung just compresses down. Okay, it's sort of like if I took a sponge, okay, and I took the sponge and I squished the sponge down, it becomes much thinner. Why? Because all the little air holes inside the sponge, when I'm not putting pressure on it, stay open. But when I push down on the sponge, I can actually squish it down to significantly smaller because I'm squishing all the air out of those little air holes. And that's basically what happens in the atelectasis. And what we do is when we look over here on this image on the right-hand side, we actually see that, okay? This area up here in the lung is a part where that part of the little alveoli have squished down. Couple problems with that is that, first of all, if that area is sort of collapsed down or squished down in itself, it looks darker because there's not as much air-filled area. So if I look down in here, I get a lot of air that's in there. So therefore, the image will look darker, okay? Where up in here, if I have just tissue and most of the air is squished out, that's why it looks more gray in this area up in here where the area of the atelectasis is, okay? The problem that we also find with atelectasis is here's the heart. You can see the outline of the heart. This would right here would be the left ventricle sitting right here. This area here is the right ventricle that sits right on the diaphragm. So this area right here would be the right ventricle. And this area over here is like the right atrium. Usually should be right about here. What happens is if this part of that lung sort of like squishes down, it pulls the whole mediastinum that way. Okay, and you can actually see that the heart is being pulled over this distance right in here. The distance right in here is the distance the heart's actually been pulled over, which puts some stress on blood vessels leaving and entering the heart and stuff like that. So basically, a lot of times when people after surgery, and if it's uncomfortable, if they have pain and they don't want to take deep breaths, they just stop using parts of their lung and they will develop this atelectasis. That's why a lot of times people after like abdominal surgery or chest surgery, they give them respiratory therapy where it actually forces them to take deep breaths, and the deep breaths will open up those areas to prevent this atelectasis from occurring. So this is something that's and also another problem with atelectasis is because the lung is collapsed, all kinds of secretions and mucus sitting there, which is a great place for bacteria to sort of multiply and breed, and as a result, then it results in a secondary pneumonia in that area where the atelectasis would be. So it's I can't say it's not common, because it is. You'll see this a lot of times in people. And also another thing you see here that shows that the size of the whole lung is increased. Here's the diaphragm on the left side. Here's the diaphragm on the right side. The diaphragm on the right side is usually a little bit higher than the left, but not this high. This is much too high, okay? So as a result, the diaphragm is being pulled up and the whole mediastinum is being pulled that way. So this whole area, the heart's being pulled that way, the diaphragm is being pulled up. Why? Because part of the volume of that lung is collapsed. Okay, and that's called atelectasis. So that's the first term. Let me get rid of my scratches, get those out of the way so you can actually see what's going on. Now this is emphysema. Okay, now we talked about the problem with emphysema is that the connective tissue that holds the alveoli together gets destroyed. These alveolar bubbles become destroyed, and as a result, instead of having millions of small little bubbles all over, in the lungs, what happens all of a sudden I end up with a large bubble, and these things are called blebs. You guys see one right here. You can actually see something up in here, and stuff like that. And there's probably one right there. Here's one right here, and there's one on top of another one right there. So basically what happens is those large air-filled cavities in the lungs, guess what they do? They don't exchange gas. What's the purpose of the lung? To exchange gas, get rid of carbon dioxide, pick up oxygen. And as a result, part of the effective function of the lung is lost simply because of the alveoli are basically destroyed, and we just have large air spaces. Sometimes these blebs will actually rip or break, and then they release air or get air into the area of the chest cavity, which then causes a problem in itself. But anyway, that's emphysema. Once this destruction does occur, guess what? You can't get it back. Once the lung's gone, it's gone. So basically, it's a chronic condition. Again, most likely brought on in most cases by smoking. Okay, so that's another good reason not to smoke. So anyway, that's a little about emphysema. It's part of that COPD, chronic obstructive pulmonary disease, uh, a whole lump of things, along with chronic bronchitis. You could also link asthma in there, even though asthma is not really because of smoking or anything like that. It's usually allergic or cold or exercise or a bunch of other things. Okay, but anyway, this is emphysema, and that's what we see, these large air-filled areas called blebs, B-L-E-B, and basically those are areas that don't work. So we have a large portion of the lung that's no longer functional in regards to emphysema. Lung cancer. Now, we could spend probably multiple hours just talking about cancer of the lung. There are different types of cancers. You know, carcinoma. If you see the word carcinoma, carcinoma means cancer. Lung cancer used to be a male-dominant disease, and the reason why was in years and years and years ago, males smoked more than females. The American Cancer Society has definitely linked smoking with the development of lung cancer, so it's a significant problem. Doesn't mean that it's always because of smoking, because there's a couple different ways. There are two different types of lung cancer. There's what's called a primary cancer and a secondary cancer. A primary cancer is a cancer that starts in the lung that may spread somewhere else. A secondary cancer is secondary lung cancer is a cancer that starts somewhere else and then goes to the lung secondarily. The most common places that cancers, and the word for that is metastasis. That's another good word that you should know, metastasis. There's a couple places that most cancers have a tendency to like to metastasize to, and I usually tell students it's the L's: lymph nodes, liver, lung, long bones, and that's where we usually get this metastasis to. So that would be called a secondary cancer. Now you can actually see right here. Here's a big nodule here. Here's a big nodule right there. Here's a nodule right there. So there's multiple areas in here that are involved with some type of a cancer. Whether it's a primary or secondary, you can't tell until you go in, take a biopsy, and look at the cells. Some lung cancers have a better survival. Some have a really horrible survival. But that's just a little about lung cancer. Pneumoconiosis. Okay, and pneumoconiosis, again, conio means dust. And pneumoconiosis is a condition that occurs in the lungs because of inhalation of dust, usually a chronic inhalation. I think I mentioned before, probably in our previous video, that what happens is people who are sandblasters, used to clean the side of the buildings with sand, there'd be a silica dust that would get in the air and they'd breathe this in, okay? And that was before they started having to be using respirators to be able to do that type of work, because they realized that if they're breathing in this dust, what this dust does, these little particles get deep down in the lung and you can't get rid of them, okay? Coal miners with the coal dust, all the carbon dust that gets in the air in coal mines, they breathe that, and that's what causes the black lung. Some types of organic dust, like on farms. If you ever go into a barn and you see the light coming through the little cracks in the barn, it looks the air looks sort of like a part. You see all these little particles flying all over, and a lot of things with hay and organic fertilizers and stuff like that stay in the air, and people breathe that in. Okay, people who do some cleaning in places that are heavily rodent infested, rodent droppings, when you start to sweep, they might be pulverized. They get in the air and they'll breathe those things in. But anytime you get something in the lung that's caused by inhalation of dust, it does cause a problem. It's called a pneumoconiosis. Okay, so that's the term they have here, pneumoconiosis. Now this is pneumoconiosis, and these are just all reactive problems in the lung. They're occurring because of the inhalation of the dust. Okay, so pneumoconiosis from inhalation of some type of a chronic inhalation, and by chronic means repeated over and over and over and over and over again, of dust. Okay, that's pneumoconiosis. Next term we have here is pneumonia. Okay, let me get rid of these scratches so you actually see what's going on here. Let me move myself out here for a second. And pneumonia could either be viral, okay, caused by a virus. It could be viral, okay, or it also could be bacterial. Okay, now this one over here, this is a pneumonia in here, and this is bacterial. I can almost 100% assure that it's bacterial. If you look at this area right here, okay, that's that right middle lobe, okay, and that right middle lobe has an infection in it, okay. If I usually find, this is called lobar pneumonia. Bacterial pneumonia frequently involves a lobe, okay. Viral pneumonia, because it's transmitted to the blood, infects both lungs equally, usually. So this is a bacterial pneumonia, whatever it is, probably a pneumococcus or something like that. I don't know. You'd have to take a culture and see what it looks like. But a pneumonia is basically an infection of the lung, which could either be by viral or bacterial. Bacterial, based upon what the bacteria is, you treat it with an antibiotic. Viral, you treat supportively. You know, you can't really kill viruses. Why? Because viruses were never alive to start out with. We've probably mentioned this before, but viruses basically are just pieces of RNA or DNA. They're encapsulated in a protein coat. And basically what they do is they get inside the body. The way a virus works is the virus gets inside the body, whether it's by inhalation or whatever the case may be, and the body says that shouldn't be there. It looks at that protein and starts to destroy the protein, and therefore it releases the kraken. All of a sudden what happens is that viral particle, that RNA or DNA, gets released and gets in the nucleus of our cells, and the nucleus of the cells, it attaches itself to our own DNA. And what our DNA does is it encodes for making a certain protein. So what happens is that now this abnormal viral DNA gets incorporated into our own DNA, and it starts making this abnormal protein, which results in disease. So it's there with us forever. That's why you really can't kill viruses. Once we get it, it's there. Okay. So, but viral pneumonia would involve both lung fields, both the right lung as well as the left lung, all over the place. Where bacterial pneumonia, frequently we get this picture like I show here, with just like a wedge-shaped area that's whiter. And the reason why it's white is because that area is pus and other kinds of fluid that's filling that area of the lobe. Okay, so that's called pneumonia. Next thing we have here is a pulmonary abscess. Okay, and an abscess, if you hear the word abscess, abscess just means an infection with a collection of pus. Okay, and this is a pulmonary abscess that we see right here. If we look right here, it's easy to see that this area does not look normal. You know, anybody could see that. What happens is if we look inside, how come it's dark here and it's white down here? The reason why it's white down here and dark, what happens is this abscess, now we have a collection of pus. And an abscess could be anywhere. It could be in your skin, could be anywhere, could be in the brain. It just means that now I have a large pocket of pus. Okay. What happens is the top right there, the reason why it's dark on the top is because that's gas. And what happens is you know, if you put fluid in a bottle, there'll be a top of the fluid, and it's called an air fluid level. And that's what we see right here. So when we look at this, we actually see that air fluid level sitting right here, okay, with the air on the top and the pus on the bottom. But that's a pulmonary abscess. Abscess just means that there's pus inside there, okay? And sometimes there'll be some gas that'll be produced by certain types of things. Some bacteria will produce gas, and that causes a little pocket like that. Okay. Next thing we have here is something called pulmonary edema. Pulmonary edema. Now, pulmonary edema is probably much more of a cardiovascular problem than it is a pulmonary problem. It's a cardiovascular problem that has a pulmonary effect. Okay. And let's think about this. When we go back to the cardiovascular system, we realize that what happens is when blood leaves the right side of the heart, where does it go? It goes to the lungs. Okay. When the blood leaves the lungs, where does it go? It goes to the left side of the heart. What happens if I have left-sided heart failure, okay? Left-sided heart failure, okay? What's going to happen is the left side of the heart can't pump out the blood. The muscle, the left ventricle, can't pump out the blood to the body through the aorta to the body as it should. So what happens? It starts to back up. Where's the blood going to back up if it can't get out of the left ventricle? Backs up in the left atrium. If it backs up in the left atrium, where's it going to back up? It's going to back up in the pulmonary veins. If it backs up in the pulmonary veins, where's it going to back up? It's going to back up and all those alveolar capillaries, because remember we talked about the alveoli are there, and then surround them is that network of capillaries around those alveoli. And again, those capillaries are very thin-walled. So now the pressure of the blood in these capillaries becomes so high, fluid leaks out of the capillaries and they fill the alveoli. And what we're seeing here, this little patchy pattern that we see all over both lungs, okay? You know, this little cloudy looking pattern all over both lungs is because the left ventricle is not working. Blood's backing up into the area of the vascular tree of the lung around the capillaries, and because the pressure in the capillaries is so high, fluid leaks from the capillaries and starts to fill those air sacs. Those air sacs now become filled with fluid. Basically, it's sort of like drowning the air sacs and stuff, those alveoli, it's drowning those. So that's what happens. So the treatment here is not like an antibiotic or anything. The treatment is trying to make the left ventricle work so we could get rid of the blood so we could decrease that. These people are usually given diuretics to decrease fluid, so therefore what happens is there's less volume that the left ventricle has to pump out and things like that. But you know, and then also then giving them medications to make the heart work better. that over a period of time, this will start to diminish. This could be a real significant problem, and it can actually lead to death in some individuals. I know that having worked in the emergency room during my residency and other places, people would be brought in sometimes from a nursing home that they found dead, and they were being pronounced, and sure enough, you look inside their mouth, there's all this pink frothy foam that's in there a lot of times, and maybe it's because of this pulmonary edema, because what happens is then they get blood-tinged fluid that's in the alveoli. It starts to fill the trachea and it fills the oral cavity. So anyway, that's all about pulmonary edema. It's more of a left ventricle problem than it is anything else, okay? So that's all about pulmonary edema. Pulmonary embolism. Now, we talked about this a little bit before when we talked about the cardiovascular system, and we talked about an embolus. What an embolus is it's something in a vessel that starts to move, whether it be a little chunk of something or whether it's a clot, okay? When we talk about the pulmonary embolism, what happens is there's usually a clot. Remember we talked about the deep vein thrombosis. Most commonly occurs in the calf veins, okay? Sometimes in the thigh, very rarely in the upper extremity, but mostly in the calf veins. So someone, for one reason or other, develops a clot in some of the calf veins. If that clot breaks loose, heads north, goes up through the legs, goes into the area of the inferior vena cava, and where's the inferior vena cava go to? It goes to the right side of the heart, right here. So therefore, this embolus, this clot, is moving through the inferior vena cava, gets into the right side of the heart, goes to the right atrium, through the tricuspid valve into the right ventricle. Everything is big, nothing to stop that clot. Goes from the right ventricle out through the pulmonary valve, still big, nothing to stop it, out to the pulmonary artery. It goes to one lung and goes to the other lung. However, once I get in the pulmonary artery, at that point, the vessels start to get smaller and smaller and smaller and smaller. And that clot, because of a certain size, is eventually going to block these vessels. You can see out here where there'd be a blockage right here, and you can see where the clot would be, you know, this in this image where the clot would actually be blocking the vessels. Well, what happens is, to be able to exchange gas, I need two things to happen. I need those airways to stay open, and I need the blood supply to provide those capillaries around those alveolus with blood for the exchanges of gases to get rid of carbon dioxide to pick up oxygen. Well, what happens is if I can't get the blood there, I can't exchange gas. If there's a large area of the lung that gets involved with this large clot, let's say a clot gets in there and blocks this whole area right here, that means the whole blood supply that goes to the gas exchange area in the lungs can't exchange gases, and basically one whole lung becomes non-functional, which becomes a real significant problem. This is interesting, okay? And you know, I'm sure that even if you have a lot of people with anatomy who've taken anatomy and physiology, they don't recognize this. The blood supply that we get to the pulmonary arteries is only for gas exchange. The tissues of the lungs are actually supplied by the systemic circulation. Okay, off the aorta, a branch off the aorta, and usually a branch off the aorta, actually goes, a couple branches, will supply the tissue of the lungs. So the lung tissue still survives simply because they're still getting blood that's coming out the aorta, going through another vessel, and they're called bronchial arteries. So the bronchial arteries actually supply the oxygen and nutrients to the lung tissue itself. But for gas exchange, it has to come through the pulmonary arteries. So if I block that pulmonary artery some way, I can't exchange gas, and all of a sudden the function of the lung goes down, and that's bad. My dad died of a pulmonary embolus. After surgery, he had been in a coma for a long time, and in ICU, and developed a DVT. Like here, you can see here's a clot moving here. It's moving up like that, like we talked about before. And basically, the clot broke loose, went to his lung, and he passed away because of the pulmonary embolism. Basically, it's all started out with a gallstone, which is crazy. But we'll talk about that when we get to the GI system. So anyway, that's pulmonary embolus, okay? Pulmonary embolism. You'll see commercials on TV. I'm living with a PE, so sometimes you see PE. PE frequently means pulmonary embolism, and these are the people who are on anticoagulants. You know, people like to use the word blood thinner. I hate to use the word blood thinner because anticoagulants don't thin the blood. All they do is they make it so it doesn't clot. And as a result, they don't want these clots to start. If they decrease the clots from forming, that clot can't break loose. If there's no clot, it's not going to break loose. So if these people are on anticoagulants for a long period of time, like usually on Coumadin or something, now they have all Lovenox, they have all these other types of, oral anticoagulants that people could take, which are much safer, much easier to use than Coumadin. Coumadin was the older type of a drug. So if you prevent the clot in some of these people who have had a history of a pulmonary embolism, that's probably a good thing. Okay. So anyway, that's a little bit about pulmonary embolism. Last thing we have on this page right here, okay, is pulmonary fibrosis. Now, pulmonary fibrosis could come from a lot of different reasons, okay? And we could be here for another hour just talking about what happens. And what happens in pulmonary fibrosis is, for one reason, whether it's because of some type of inflammatory condition, whether it's some other type of a medical condition, or whether it's just something called idiopathic, which means you can't figure out what the reason is for it in the first place, okay? What happens is then the lungs become scarred. And if you look at all the lung tissue here, all the lung, these are called lung fields. Okay, when you hear something lung fields, all this lung tissue, see how white it is, and there's all these little strandy looking things. That's all scar. What happens is, think about it. If you have an area that has a scar, it doesn't stretch very well. The purpose, the way that we fill the lungs with air is the lungs have to stretch. When the diaphragm goes down and the chest cage goes up and out, it increases the volume, and because of this negative pressure that's between the lung and the wall of the lung, because of that pleura, the lungs get pulled open, just like opening an accordion or opening of a bellows, okay? And the air comes in because the pressure on the outside is greater than the air pressure on the inside of the lungs, and the air comes down the trachea, down the bronchi, and into the area of the lungs. Well, what happens if I have this pulmonary fibrosis? The lungs become so scarred they can't stretch. So as a result, they can't inflate the lungs nearly as much. And that's the big problem that we see with people with pulmonary fibrosis. They just can't inflate the lungs, and it becomes a real significant problem. And that's what's here. Again, once they get that scarring, guess what you do for it? Nothing. There's really no cure. And again, there's a billion different reasons why people may have pulmonary fibrosis. Once it's there, just like COPD, like emphysema, like chronic bronchitis and stuff like that, there's really no cure. It's there. The only cure would be a lung transplant in certain situations, and that's a very radical cure. So this is talking about some of the pathological terms that we'd see with the lung, which I think are pretty interesting. Some pretty cool things. We took a little bit more time on this than we otherwise would, but hopefully it's informative, and maybe some of the things you had some questions about are now answered. Okay.